So in this session, we'll start with the peritoneum one. Let us see with the introduction. So what are the two types of peritoneal layers and peritoneal fluid, structure of peritoneum and function of peritoneum. So then in further sessions, we'll be dealing with the peritoneal folds and ligaments, then vertical disposition, horizontal disposition, and then the peritoneal cavity. So without further delay, let us go into the topic. So peritoneum is the largest serous sac. In west, viscera partly or completely. Visceral layer lines the abdominal walls. Parietal layer. Visceral and parietal layers separated by potential space filled with capillary layer of fluid. So in males, peritoneal cavity is a closed sac, whereas in females, peritoneal cavity is an open sac because it communicates outside through the pelvic ostia of the uterine tube. Parietal layer develops from somatopleuric layer of mesoderm supplied by somatic vessels and nerves. Receives all modalities of cutaneous sensation. Visceral peritoneum develops from splanchno-pleuric mesoderm supplied by visceral vessels and autonomic nerves. Visceral layer is insensitive to pain, tactile and thermal sensations. Along the line of reflection from visceral to parietal, nociceptive sensations persist. So expressed as signs and symptoms of shock when mesentery is subjected to traction in an anesthetized patient. So now, peritoneal cavity has two intercommunicating sacs, the lesser sac or the omental versa, which is behind the stomach, and the greater sac. So both will be communicating through the epiploic foramen, otherwise called as adytes to lesser sac or foramen of Winslow. So it is a communication between two sacs. Boundaries of epiploic foramen are like this. In front it will be the right free margin of lesser omentum, behind it will be the inferior vena cava, above it is the caudate process of liver, and below is the first part of duodenum. So peritoneal cavity, most of the abdominal organs are covered by peritoneum of greater sac. Only the following are invested by the peritoneum of lesser sac, namely the caudate lobe of liver, posterior inferior surface of stomach, posterior surface of the proximal half of the first part of the duodenum, anterior superior surface of the transverse colon, then the anterior surface of the neck, body and tail of pancreas, gastric area of the left kidney, upper part of the anterior surface of the left suprarenal gland. So structure and function, the peritoneum is a single layer of flattened mesothelial cells resting. They rest on subserous loose connective tissue, and tight junctions are present between mesothelial cells. But on greater momentum, fenestrations are present between the mesothelial cells, and there will be bidirectional flow of peritoneal fluid through the peritoneal membrane. Subserous connective tissue has macrophages, fibroblasts, lymphocytes, plasma cells, and mast cells. The macrophages migrate actively through intact serous membrane. Then the aggregation of lymphocytes are observed as milky spots in the greater omentum. So peritoneal fluid, it contains water, electrolytes, traces of protein and urea. So desquamated mesothelial cells, macrophages, lymphocytes, mast cells and fibroblasts are also found in the peritoneal fluid. It is derived from the interstitial fluid of the subserous connective tissue and from the plasma of the neighboring blood capillaries. So functions of the peritoneum: provides a wet and smooth gliding surface which prevents friction. So prevents spread of infection by the greater omentum, which wraps an inflamed organ. Then provides nutrition and innervation to the contained viscera by various peritoneal folds. So peritoneal folds helps in partial retention of the abdominal organs in position, helps in defensive mechanism, provides surface area for absorption. So this is the principle behind ventriculoperitoneal shunt, which is done in case of obstructive hydrocephalus. Ventriculoperitoneal, from the ventricles of brain to the peritoneal cavity, there will be a catheter which will be guided. So ventriculoperitoneal shunt in case of obstructive hydrocephalus. So because this surface area provided by the peritoneum for absorption is more. So then excrete some waste products. So this function is used in peritoneal dialysis. Then a collection of oocytes is taken from the pouch of Douglas, caldosynthesis. So these are the functions of peritoneum. So with this introduction, we'll go ahead with the further lectures in next videos. That will be the peritoneal folds and ligaments, then the vertical disposition, horizontal disposition, and the peritoneal cavity.